Non-alcoholic fatty liver disease really does affect 20 to 30% of the U.S. population. About 3 to 5% of the U.S. population will go on to develop steatohepatitis and steatocirrhosis, and it's now the single most common cause for liver failure in the United States. So these patients that have steatohepatitis are at risk for liver failure and liver cancer.
So it's in a patient that doesn't drink alcohol in amounts that will predispose them to have alcoholic liver disease. That in most cases will have risk factors, the ones that we call the metabolic syndrome, hypertension, hyperlipidemia, diabetes, and last but not least, obesity.
These patients actually are at risk for coronary artery disease because they have shared risk factors, and the most common cause for death in non-alcoholic fatty liver disease is coronary disease, and they're at risk for exogenous malignancies.
The prevalence of this is quite high. It's at least 5.5%. So if you look into take into account other liver diseases, it's at least 3 to 10 times more frequent than hepatitis C.
Signs that they may be progressing would be abnormal liver chemistries, marked fatigue, and obviously if they develop jaundice, ascites, bleeding, or hepatic encephalopathy.
So I will do some autoimmune and metabolic markers of liver disease, along with the viral hepatitis serologies if the liver tests are elevated. And if all of those markers are unremarkable in the right clinical setting, I probably will say this is most likely non-alcoholic fatty liver disease.
So the mainstay of treatment is typically going to be exercise and weight loss and getting rid of the potential risk factors, good control of the diabetes, good control of the hypertriglyceridemia, good control of possible hypothyroidism, getting rid of any drugs that may be involved in terms of causing fatty liver disease and avoidance of alcohol.